Hello, welcome back to our crazy live Facebook. I'm Dr. Kyle Duryea with Simply Health Chiropractic.
And I'm Dr. Aaron with Simply Health Chiropractic.
We're here in St. George, Utah, and this is our chiropractic office, and this is our Facebook Live. We do this every week, just talking about different topics on Upper Cervical Chiropractic versus stuff.
Everything else, right?
Yeah, so today we've chosen the topic of sports and athletes. So, what is Upper Cervical really doing for sports and athletes these days? And we're really excited. We actually just had a snowfall.
Yes.
And so we got dripping, and you'll probably even hear the drain a little bit in the background, but from the roof. But we're pressing forward either way, talking about how we can improve in sports and the athletes in sports and all sorts of stuff.
Because we see that most professional sports teams, I don't want to say all, but most all of them have a chiropractor on staff.
Yeah, there's obviously something to it.
Right. And so they see something and it helps, so let's keep doing it.
Right.
And we know athletes are always trying to get an advantage wherever they can, legally.
Legally, yeah. Not illegal advantages.
Not illegal. And so it's just interesting to see the results people get from either improving their abilities in the sport or decreasing healing from just, doing your normal workouts to even injuries.
Yeah.
That some of the stuff we talked about already, and concussions and the healing part and all the aches and pains that come with it.
So there's an interesting advantage to using chiropractic, especially upper cervical, where we focus specifically on top two neck bones. And it's interesting because a lot of these cases are only upper cervical cases. Right. But not only are we seeing athletes who are in pain get out of pain, we're seeing improvements in healthy athletes.
That's right. We just looking at a few of them, like some of the areas where people want to improve, where I would think if you're an athlete, you want to improve your eye-hand coordination.
Right.
Your ability to breathe, have your endurance, because you don't want to be one time down the basketball court and feel like an 80-year-old man.
Yeah.
And also just overall improvement in the sport that they perform. So one of that we were looking at is just eye exams, just doing the normal eye exam where you read the letters off the chart. And they tested 67 patients from 7 to 79, and they saw that those, after 6 weeks of upper cervical, had improvement in both eyes.
So they tested ages from 7 through 79.
Through 79.
And clients who had been using upper cervical care had improvement. Wow, that's crazy. That's only after 6 weeks of care.
Only 6 weeks.
So that's a pretty good improvement.
Right. And if that's a quick improvement in 6 weeks, imagine over time. Of course, there's going to be limits to matter. I don't think I'll ever be out of glasses.
Yeah. Well, I know some people that have been.
Right.
So there have been improvements such that people, don't wear glasses anymore, and that's, so that's good. So that's a significant change.
Right.
For some people.
Mm-hmm.
I may think of people like who are doing rifle shooting, or who maybe even in my own sport, swimming. Shout out to my peeps down there. But I have to look at a wall. I got to see the wall. So if I misjudge a wall,
then you're going to say, ouch.
Or miss it, or slip on it, or something.
Right.
So there's that's a significant improvement. That's a significant change.
Right. The other one, breathing. This tested older people for ages 48 to 80, but they found that after care, there's improved exhale after a deep inhale. So they're able to decrease more. If I'm in my head, if you're able to exhale more air, you must be breathing in more air.
More oxygen.
More oxygen.
Yeah, getting some more oxygen there.
More air, more oxygen, more energy.
Right.
And increased endurance.
So this is interesting because, we're only adjusting the neck.
Right.
So, neck and eyes, you can kind of see the correlation. What's the connection between neck and lungs?
Lungs, we have the vagus nerve.
Right.
That travels everywhere.
Everywhere. Well, it starts from the top neck bone
up
region.
Here and works down and
through the brainstem, travels down through the neck, right through the little hole that they call the hiatus, into the thoracic cavity, and innervates the lungs. And what's the vagus nerve's job for that? It is simply to inspire the parasympathetic nervous system so that you can relax and heal. When the parasympathetic nervous system turned on, right, then so must be then maybe there's a few extra connections there, but wow, just turning on the top neck bone, getting some more oxygen there, deep breath, getting that vagus nerve to again work properly.
Right.
And Dr. Aaron, also if we're talking about vagus nerve, we're also talking about all the guts, your stomach, your heart, your small and large intestine, the liver, the spleen. You got to say it that way, spleen.
That's right.
Yes, the spleen. The gallbladder.
Right.
All the way to the top of the kidneys is all innervated by that one vagus nerve.
One of the cranial nerves.
Yeah.
And it's interesting because if you think of all the other aspects of what we talked about, just with the cranial nerves in that area, vision, eye movements, coordination, and all those things, right there at the top of the neck bone.
Because we got 4 nerves really that interconnect. There are 3 that are intimately connected with the top neck bone. That's cranial nerves 3, 4, and 6.
Right.
And then we got this second cranial nerve, which has a connection to the neck. It's not directly intervened with the neck, but has connections.
And those are all vision.
And those are all related to vision.
Vision, eye movements.
Focus.
Right.
Yeah. Okay. So we have some interesting, significant happenings here for athletes to be able to improve in their condition. Yeah.
The last one that we were looking at was one that I thought was a lot cooler because it was baseball players, and they looked at, and it was random, so they took some who got chiropractic care and some who didn't.
Right.
Or they thought they wuld get a mock adjustment because with the upper cervical, you don't have to do the twisting and popping the neck. You can fake it. We don't fake it.
We don't fake it. But you can fake it.
But you can
They faked it for this.
In the first 5 weeks, those who were receiving upper cervical care received increased muscle strength, long jump, and microcirculation in the fingers.
Okay, so wait a minute. So these baseball players,
right?
They received increased microcirculation in the hands.
Mm-hmm.
That might be important for catching a ball,
right,
or throwing a ball, right? Okay, so that's good. They improved their long jump,
which means muscle strength there.
Increased muscle strength.
And they're jumping to catch balls.
Yeah. So that's crazy. Upper cervical chiropractic was shown to improve those statistics. That's awesome.
And that was in 5 weeks.
In 5 weeks they only had 5 weeks of care.
Well, then that was the first 5 weeks.
Okay.
And the next 14 weeks, both sides saw improvement from the previous, but they're still working as athletes. They're going to improve. But those who received chiropractic care, they didn't see a lot of improvement in all the areas, but their vertical jump increased.
Yeah.
Also, their resting heart rate, blood pressure, and pulse, even pulse after running on a treadmill, was able to go back to the normal quickly.
Right. Okay. So that's some fantastic improvements for athletes. And I think one of the things we've discussed before is the ability to heal properly.
Right.
So if you're an athlete and you're beating yourself up, not only are you going to be able to heal faster,
right,
but now your body's working better to recover you faster, increasing strength, increasing blood flow to the areas that require healing and strength. Wow, I think that was a fantastic study. To be able to look at that and say, over the course of, what was that, 19 weeks?
14 weeks.
Okay, but the total study was 19, right?
No, first 5 and then 14 weeks.
So total of 19 weeks.
Okay.
right?
I was going with 14 weeks, but.
Oh, was it a total of 14 total? So there was 5 and 9 weeks?
Right.
Okay, so, well, I was a little confused there for a minute, I guess. It's fine, it's 5 and 14, I just added those together, but the 5 was in the 14.
Right.
So over a total of 14 weeks, they started to have some interesting differences.
Right.
Those who had received chiropractic care versus not. That's fantastic. I think that's great.
Right. It's just, it goes to show, even with the sham adjustment, people in that group, yeah, they improved, but they weren't improving like those who received the actual.
So there's something to be said about the placebo effect still.
Right.
Okay, I get it, but we still get to see improvements from those who are getting the physical adjustments. So there's something to be said on top of.
Right. It's just saying that they improved even more because, they're athletes. They're going to be, any athlete who works out and does are going to improve, but the significant improvements of those who receive the actual adjustment.
So we had some interesting, because we've had a couple of athletes. In fact, we even have some athletes in the office who have brothers and sisters in the office, and we see some significant changes with those athletes.
Right.
We actually had a couple of clients who had trouble breathing. They've had some difficulties with lungs and things like that, and they were on tons of medication and everything, and they still, even to this day, they're still a little bit there. But ever since we made that first adjustment, they've been able to breathe better, remove tons of medications. They used to be on oxygen 3 or 4 times a day.
Right.
They actually didn't even know if they were going to live for graduation. They were using so much oxygen.
Crazy.
Yeah, we made that first adjustment though, and now they're breathing normally most of the time. Their body's healed properly. They use very little medication for breathing. It's been fantastic.
Right.
So I can see, where our translation for that is, your body's healing the way it's supposed to. It's great how you feel. We all feel. It's you're good. Feeling's great, but if you're healing better,
that means you're going to get back to play faster.
That's right. You're going to get back to play faster. You're going to get those improvements like we saw in the baseball study, and you get to go to play faster.
I
guess that was still the whole thing that I'm saying.
Well, especially in high school sports, you don't get all those athletes who are, when summer hits, a lot of them are playing sports throughout the year. It's changing a lot now, but I know whenever I would go from one sport to the other, the conditioning wasn't the same. And so getting that, I wish I had upper cervical care when I was younger and going through all this stuff, because that means maybe I would have been better.
Well, what also it shows is that sometimes it doesn't matter how you feel.
Right.
Because you see these athletes improving. I bet you they didn't. I mean, they were hurting because of workouts, maybe they were sore and stuff. But they were improving without saying, "Oh my gosh, there's a problem."
Right.
Right. So imagine 30, 40, 50 years of all those of that trauma occurring. They might have something coming up later that the body's having trouble healing, and that's not just not the case. Now we know upper cervical care improves performance for athletes in sports.
Right. And we get people who come in with sprained strains,
Of course.
And, typically that's a 4 to 6 week
healing process. Yeah.
But we see coming in at 3 to 4 weeks in the lower end of that. Yeah. And those, we still get some who take a little bit longer to heal. But if you can imagine, you're going to tear muscles when you're working out. Not that it's a bad thing. It hurts.
Right.
But if we can heal those quicker, that means you don't have to delay the healing process.
You get back there faster. And it is a process. And, we've had that discussion with many of our athletes in the office. Hey, this is a process. Your body heals one stage, one step, one particle at a time. You have to think about those little tiny cells all got to heal up. They're pretty tiny. Yeah, I think sometimes we think of muscles as this big stretchy thing, and it's just, it can heal up. No, there's thousands to millions and billions of cells in those muscles and tissues. Right. And sometimes you got to take them out and replace them, all sorts of stuff. So there is a process of allowing the body to heal naturally without interfering with the healing process.
Right. So it's just amazing just to watch. I look at what I do and I'm like, I helped with that. I didn't heal them, got that top neck bone into place and allow the body to do what it was designed to do. And that's one of the most amazing things to me as a chiropractor.
Right.
Sometimes I'm like, it's going to work. And I'm just thinking in my head, how's this going to work? And then it works.
Right. Well, I think that's something to know for people out there that, upper cervical chiropractors, we do not claim the ability to heal.
Right.
The only thing we're doing is removing what we call vertebral subluxation, the interference, from the joint or the bone pressed upon the nervous system, spinal spinal cord, or the brain stem. That's where the brain stem lives, is through the top 2 neck bones. And if we can do that, well, then we can restore the balance between your brain and your tissues and allow for that healing up to occur.
Right. Get that communication open.
Mm-hmm. Throughout life.
Throughout
life, if we can.
And be there whenever that communication gets disrupted.
Right.
And correct
it again. Well, if you're an athlete and you're looking for that edge, legal edge, and you are looking for some improvement to heal, to maybe jump a little higher, breathe a little better, have some better hand-eye coordination, then find your upper cervical chiropractor in your area. We practice the Blair technique, the Blair Upper Cervical Chiropractic technique. You can find that at blairchiropractic.com. You can find our office at simplyhealthchiropractic.com. Our phone number is 435-688-0444. And we do, if you mention these videos, you get a free consult and a free spinal screening to see if we actually can assist you. Yeah, see if we can unlock that top neck bone for you. Sometimes we can't, right?
Right.
Yeah, sometimes there's somebody who's already in place, but you know, more often than not, we find a neck bone that can be
right. And
adjusted.
If you know we can't help you yet, just wait. Again, when we talked about neck injuries.
Yeah.
In sports, there's going to be neck injuries.
Yeah. Well, there's always those fun little moments of jarring with the neck.
And so.
Yeah. If you're looking for a chiropractor in your area,
you can look for upcspine.com, and you can find one in your area. Even if you're not in this country, you can find someone.
Yeah.
Not in the United States. So.
Yep. So lots of chiropractors on there, and we appreciate those guys for having that resource for us. BlairChiropractic.com also has a doctor avenue there. So if you're looking in your area, if you're not finding anybody, you're more than welcome to send us an email, frontdesk@simplyhealthchiropractic.com, and we'll get that, or you can just post it in the comments, and we'll see if we can find somebody around your area.
Right.
There's going to be more of us.
There's going to be more. Yeah,
so upper cervical chiropractors, more chiropractors moving into this kind of direction, and we're nothing against our other brothers and sister chiropractors, just we love upper cervical, we love the Blair technique. If we can find someone for you, we will.
And have a good, fun week, and we'll see you next week. What are we talking about next week?
I think we're going to talk about, actually, I forgot.
Personal injury.
Thank you, personal injury. I knew it. We're going to have a guest on here. That is going to be Brent Hymas. Yeah, Brent Hymas.
With Farm Bureau Financial Insurance.
Right. I think you said it right.
I think I did too.
Yeah. He'll tell us again next time.
He'll watch this and say you didn't say it right.
Yeah.
We'll get it right next week.
We love Brent.
Yes.
Yeah. He's going to be with us next week, so we're going to have fun with him and talk about that scenario of personal injury, car accidents, and other insurance things to kind of watch out for with chiropractic care. So thanks very much, everybody. Have a great week. Have a great weekend.
We'll see you.
See you then.